Hi everyone, this is Ari Pence.
And this is Gwen Dirk. So this is a quick introduction to integrative medicine. We hope to provide you with a brief history of integrative medicine, define what integrative medicine is, and describe some of the core components of integrative medicine.
This podcast was part inspired by Thrive, the health and wellness initiative at the University of Illinois College of Medicine. If you're interested in learning more about Thrive and what we're doing at the College of Medicine, you can check us out on Facebook. And overall, we're just very passionate about integrative medicine, and we hope to inspire you to use an integrative approach with your patients in the future. We hope you enjoy it. So we'd like to start out with a brief history of integrative medicine because I feel like it's a really important way to understand why and how integrative medicine came to be so popular in the U.S. So Aristotle is often thought of as one of the very first holistic physicians who believed that every person was a combination of both physical and spiritual properties with no separation between mind and body. And that was really the prevailing thought in the early 300 BC. And that stayed the same until really the 1500s and into the 1600s, when Descartes believed that the materialistic scientific thought could actually reduce the conscious mind to something that could be manipulated. And he believed that the mind and spirit should be the focus of the church, while the physical body should be under the study of physicians. So this led to what is known as the Cartesian split of mind and body. And it was continued when well-respected philosophers like John Locke and David Hume advanced this notion with the reductionist movement. And the idea within the reductionist movement was that any naturally occurring phenomena could be reduced to its independent parts. The idea being that the human condition could be separated into each organ system and then studied individually. So this certainly led to an explosion in the medical field within research and science, but it left much to be studied in the way of mind-body connection.
So then in the early 1900s, medical technology began to soar. And in 1910, there was a big concern about the quality of medicine that was being practiced. And this is how the Flexner report came about. And it really was a report that was on the quality of medicine and how can we improve the quality through evidence-based research, education, and clinical practice improvements. So that's what the Flexner report is about.
And then in the mid-1900s and even into the early 2000s, we saw a huge rise in the number of subspecialists after the Flexner report really redefined medical education. And we were able to do so much more, but the cost of healthcare spending really rose significantly. The total healthcare expenditures actually reached $2.9 trillion in the year 2013. And this is a significant burden in the United States. And so with the prevailing reductionist thought, the focus has been for so long that a single disease can be treated with a single medication and specialized surgeries. And this resulted in a massive spending in the U.S. This system encouraged the belief that each problem has a separate cause and a unique solution, and discouraged the focus of the interplay between mind, body, and environment.
And so also around this time, the interest in CAM, which is complementary or alternative modalities, began to rise. And this is partially due to the fact that a lot of the diseases used to be infectious diseases that were the main killers. And as we learn more about those, we've seen this great shift in chronic diseases now being the leading killers, and the way that we were approaching these in medicine was not as effective against these chronic killers.
Yeah, and so around the same time as this shift from infectious disease being the cause of mortality to chronic disease states, there has been a disconnect between patients and their satisfaction with their physicians, which in part led to more interest in complementary and alternative modalities. And so in 1993, the research world really did recognize that the complementary and alternative treatment methods needed to be researched in robust ways. And so the NIH actually created the Office of Alternative Medicine, And then in 2014, that name was actually changed to the National Center for Complementary and Integrative Health. And the funds available for research has really grown quite substantially in the last several years.
And I just wanted to report really quickly to how in the 1990s there was 42% of the public reported actually using CAM modalities. So that's a significant portion, and that number has continued to grow.
Yeah. So in then 1997, Andrew Weil actually created the first 2-year integrative medicine fellowship at the University of Arizona, which continues to be a very popular fellowship for practitioners who would like to use an integrative approach. And the goal was to educate practitioners in integrative medicine and emphasize the relationship between the practitioner and patient, and doing so in an evidence-based way and really approaching it from a scientific research model.
And so then in 2001, the Institute of Medicine published a report on the overall state of the U.S. healthcare system. In 2006, the American College of Physicians also published a report, and sort of the gist of the report is that we are not doing good medicine anymore, and we need to sort of restructure how we're approaching our nation's healthcare system. So primary care is thought of as the backbone of the nation's healthcare system. It's really at a grave risk of collapse due to the dysfunctional financing and the delivery of that system. And it really emphasized a patient-centered care. And that's really what integrative medicine is patient-centered care.
Yeah, and then in 2013, the American Board of Integrative Medicine was formed to recognize the importance of competency in the field of integrative medicine. So it is now a well-established fellowship that you can graduate from and then take your board certification to become an integrative provider.
So that's just a brief history of what integrative medicine is. And to define integrative medicine a little more specifically, we talk about it as the goal being to facilitate health within complex systems, from the individual to the communities and the environment in which all things live. And again, I had spoken how it's really putting the patient first and in the center of the care. It's addressing all of the components of their health, not just their physical health, but their emotional health, mental health, social health, their financial health, their occupational health, environmental influences, their spiritual health. All of these really affect a person's health.
And in really understanding and getting to know your patient and understanding all of the aspects that create their health and wellness, you can understand what they need and create treatment plans that are individualized to your patients. And in integrative medicine, practitioners use multiple modalities, including the allopathic or traditional Western medicine, as well as osteopathic and Eastern treatment models, and complementary and alternative methods for treatment, as well as disease prevention.
And this is also the patient and the practitioner are really partners in the healing process. It's not just a sort of one-sided doctor telling the patient this is what you need to do. It's a relationship that gets built over time. So integration, this integration means that we're focusing on health and a healing-based physician-patient relationship. We're developing a relationship with the patients and understanding all of their unique cultural beliefs and their needs to help them in the healing process.
And we also wanted to point out that integrative medicine does not equal complementary and alternative medicine. And in fact, we'd like to talk a little bit more about complementary and alternative medicine, which essentially is individualized treatments that are used to replace the allopathic or Western treatments. And with integrative medicine, the goal is not at all to replace, but instead to enhance and use multiple treatment modalities that the patient believes in and can really adhere to. And so that continues to require an emphasis on the patient-provider relationship, because you have to understand your patient and you have to know him or her really, really well to understand the needs that in their treatment goals.
Right. And also these treatments are all backed by evidence-based science and medicine. So they're not just we're not prescribing anything that's not evidence-based, so it's still based in good science. Yeah, and then also I wanted to emphasize how this type of integrative care is really the ideal treatment for patients with chronic pain or chronic conditions. We're, not saying throw everything from allopathic medicine out the window. That is still very important for so many issues. But when you're dealing with the chronic diseases, you're never going to cure the patient. They're going to live with that disease their whole life. So you want to figure out, how can we give the patient the best quality of life possible?
So this next slide is really just a pictographical representation of the multiple modalities or areas of focus in integrative medicine. And I can't emphasize enough of how important it is to understand not just the physical disease that the patient is complaining of, but also what emotional factors in their life that can be exacerbating the disease, or what spiritual or intellectual or social, even environmental factors are coming into play. And so it's really important to not just put all that stuff into the social history and then never really look at it again. But it's really important to understand how these individual aspects come together to create the whole person. And so that's why a lot of images or pictographical representations look like these. They are spectrums, and that is how the integrative practice, strives to be. It's to look at every single part of a patient.
And so this is a graph then of the most common complementary therapies in 2007. And you can see some include meditation, chiropractic care, massage, yoga, diet, relaxation, different kind of guided imagery, homeopathic treatment. So these are some of the ones that are considered more alternative methods of treatment. But this is not an exhaustive list. We just wanted to show you sort of what were the ones in 2007 that were most commonly being used.
And this next graph is similar. It's just another way of looking at it. It shows what were the most common conditions or diseases that complementary and alternative techniques were used. And so you'll notice that a lot of this is chronic pain, so anything from back pain, neck pain, or arthritis. And then there's also several other chronic disease states that you'll see that integrative approaches have been used.
So the way I see integrative medicine is that it's sort of a union of public health and community health, where it really focuses on disease prevention. So instead of waiting to treat the disease till it's at a more serious state, we work on promoting these lifestyle changes and how can we really make someone literally thrive. And thinking of the patient as a whole person and all those elements of a person's health.
And so it's all too often that providers can fall into this almost trap of seeing patients as just symptom sets, and then we're not at all surprised by the chronic disease states that they present with, because the patient with a very sedentary lifestyle who's been smoking for 45 years, who binge drinks on the weekends and eats cheeseburgers every night, when they present after a massive heart attack, it's unfortunate that we're not at all surprised by this. And an integrative approach really strives to create that relationship and with the patient so that we can almost anticipate their needs in a way that we can direct our treatment and to find different integrative approaches that the patient can believe in and then adhere to.
So in summary, integrative medicine is really a focus on healing and not curing. With the chronic diseases, we cannot never cure the patient, but we work to give them the best quality of life that's possible. And again, we focus on all the elements of a patient's health.
And so we hope you've enjoyed this brief presentation on what is integrative medicine, where did it come from, and what are some of the core beliefs or foundations to an integrative approach. If you'd like to know more, we've listed resources that are available. And if you have any questions for us, you can always reach out to us on Facebook.
Yes, on the Facebook Thrive. And just a quick list of our citations here. We can make the slides available to you if you'd like. So just let us know. All right, thank you.